Hey, it's Chris with Rowe Dental Laboratory, and we have a very special guest today. We've been working with her and her company for a while now, and we have Joanne Villani from PreVu Software. And we're going to learn a little bit about how this software can help close cases, big aesthetic cases, small aesthetic cases. Overall, it's a great software. Like I said, we've been using it for a long time. Let's talk a little bit about how you think the PreVu can help with, especially with these companies that are paying for this marketing, the high dollar for the marketing to get the high dollar cases. They don't feel like they're getting their money's worth. How can PreVu help get them over the hump and kind of just reset the office and really get some leads closed because of it?
Yeah, it's a really important topic, and I just want to speak a little higher level at first. So many offices are investing in marketing to bring these cases in, which makes them very competitive. Unfortunately, not every office is prepared to accept all of these leads. So there's not a lot of follow-up, or they don't have the communication skills to close the cases. And when you get people in from marketing, you're really versus, let's say you're a specialist who's getting a referral from a general dentist. When you're marketing, you're sort of casting out this really wide net. So there's a couple of different issues that are specific to marketing. Number one, when the patient inquires either by calling or maybe a web form, someone has to be trained enough to reach out to them. And the first thing that has to happen, I call it the first sale, is they have to actually get the patient to agree to schedule. But then the patient actually has to show up. And with people marketing, I've heard as high as 50% no-show rates. And then the patient actually, when they do show up, you have to close them. Right. So a lot has to happen for that patient to find your ad, call your office, actually agree to come in, actually show up, and now be sitting in your chair. Yep. You have to use every tool you have available to try to close that case. And when we're working with clients, we have a whole implementation protocol, and we give scripting and coaching included. So we can do things to try to help entice people to come into the office, to show up for their appointment. But the differentiator really is, number one, this is the most important, it creates the emotional connection. These are really expensive cases. Yep. People buy on emotion. Anyone listening to us should think about something that they wanted to buy that in their life was significant in cost to them, probably wasn't an impulse buy. So we really need to trigger that emotional connection. I was actually at a marketing meeting, and one of the doctors that was lecturing had recorded a patient, and the patient said, when I saw my smile for the first time, it was surreal. I didn't believe it was me. I thought I was looking at a Photoshop version of me.
Oh, wow.
Right. So what we try to do with PreVu is teach offices, let's get that emotion that people feel when they hold that hand mirror to their face for the first time, or you walk them over to a bigger mirror and they go, oh my God, I can't believe this. I can't believe this. We want to move that emotion up into the consult, because if we can trigger that emotion, we can leverage that emotion to help overcome objections. Yep. Right? I can't do it. It's not me. Not right now. I'm not sure. But we just saw you get so emotional. We know that this is important to you. We've learned things about them, and we can utilize that to help them to say yes. But even if they don't say yes today, people go home with their simulation. They share that simulation with their spouse. So sometimes, or the co-decision maker for the financing, that's an important conversation. And just sending someone home with a paper with fees and codes isn't going to cut it. You need that co-decision maker to see the transformation and go, oh my God, I can't believe this. We need to make this happen for you. And those people give them so much positive feedback. Because without that positive feedback, they lack the confidence to move forward with spending this type of money. What if I make a mistake? So many offices think it's all about the money. And it's a mistake to think that. People will say, oh, everyone wants to do this. If they have the money, they're doing it. No, they could probably find that money. They're not bringing it to the table because they're not convinced that it's worth the money. If you don't show them the transformation, you're not showing them one of the biggest benefits of getting this treatment done, and you run the risk of losing the case. Right. So if you're marketing, you absolutely have to have the right people in place. But if you don't, You certainly need PreVu to create the emotional connection.
Yep.
You absolutely need people who are trained to overcome objections. But if you don't, you certainly need a PreVu. Contact us, get PreVu, get us training your team, because our training is a lot involved in terms of how to make money with PreVu.
Right.
And I say that from a business perspective. Obviously, it's the patient care. We want to deliver the best outcomes. We want to help people change their lives. But at the end of the day, it's a business. And if you're investing in marketing, you absolutely want to maximize your return on that investment.
Yep.
And potentially, if your close rate goes higher, and marketing companies aren't going to want to hear me say this, you can spend less on your marketing.
Right.
Because you're seeing the same amount of people, but you're generating more revenue.
Yeah.
So it's really important. I think if you are using any marketing company to bring in these implant retained denture cases all on X, you must be set up and have something. I say something like this because I want to sound, but PreVu is really the best tool. It's like about a minute, less than 90 seconds. You have the simulation up on the monitor. We teach you how to do a big reveal. We work with your treatment coordinator and your patient advocate. We really want to help you to implement this fully. So it becomes a non-negotiable, because so many people say, oh, I'm so busy. Okay, but let's think about this. You paid to get that person in. Your patient advocate successfully scheduled them.
Right.
They actually showed up.
Right.
But yet you're too busy in that console to do everything you can in that moment to close that patient.
Right.
Makes
right.
sense.
Yeah.
We have to start thinking in processes and protocols and make this a non-negotiable, and we help you do that.
All right. Well, that's great information. Thank you so much for your time today. And please tell us how to get a hold of you. Website, email, what's the best way?
Yeah, so thanks for having me. This was fantastic. If you want to get a hold of us, you can go to our website, prevudental.com, PREVU dental.com. You can schedule a demo. There'll be a link right there, or just go down to the footer. Our email is there. Our phone number is there. You can even reach us through chat on the website if you'd like someone to reach out to you. So we're pretty easy to find and get a hold of, and we'd love to talk to you.
Awesome. Well, thank you so much. And listen, if you guys don't want to reach out to PreVu right away, please feel free. Contact us here at Rowe, and we're gonna get you there anyway. But if you have any questions on it, of course, definitely go to their site. But if you want to give us a call and talk through kind of what we've done over the years, we would love to have the conversation. So again, thank you so much.
Thank you. Thanks, Chris.